Welcome back to Calm Mind and Healthy Body, our channel. Vitamin deficiency is a topic that often flies under the radar, yet it plays a crucial role in our overall health, particularly when managing pain conditions like sciatica. Sciatica, characterized by pain radiating along the sciatic nerve, can significantly impact daily life. Understanding the connection between vitamin deficiencies and sciatica pain is essential for anyone looking to alleviate their discomfort. This video will explore how specific vitamins can help reduce inflammation and support nerve health, potentially easing sciatica symptoms. Viewers will learn about critical vitamins such as B12, D, and E, which are known for their roles in nerve function and pain management. We will discuss how these vitamins contribute to muscle and nerve health, and how a deficiency can exacerbate sciatica pain. Moreover, addressing nutritional needs is not just about managing pain, it's about enhancing overall well-being. By understanding the significance of vitamins in our diet, we empower ourselves to make informed choices, leading to a healthier lifestyle. So, whether you're currently experiencing sciatica or want to improve your health, stay tuned as we delve into the vital nutrients that can make a difference in your life. Before we dive deep into the main subject, if you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell. Hence, you'll be updated on health tips, recipes, and wellness inspiration. I appreciate your support. Understanding sciatica pain. Sciatica refers to pain originating from the sciatic nerve, which runs from the lower back down through the hips and buttocks and extends into each leg. This pain can manifest as a sharp shooting sensation, numbness, or tingling, often affecting one side of the body. For many, sciatica can significantly impact daily life, making simple activities like sitting, standing, or walking uncomfortable and challenging. Common causes of sciatica include herniated discs, which can press on the sciatic nerve, and spinal stenosis, where the spinal canal narrows. Other contributing factors may include muscle imbalances, poor posture, and lifestyle choices such as prolonged sitting or lack of physical activity. These elements can lead to increased pressure on the nerve, triggering pain. While addressing the physical causes of sciatica is crucial, it's equally important to consider the role of nutrition in managing and preventing this condition. A balanced diet rich in anti-inflammatory foods can help reduce nerve irritation and promote healing. Nutrients like omega-3 fatty acids, vitamins B12 and D, and magnesium can support nerve health and muscle function. Individuals can take proactive steps toward alleviating sciatica pain and improving their quality of life by focusing on physical and nutritional aspects. The role of vitamins in nerve health. Vitamins are vital in maintaining nerve health and facilitating effective pain management. Essential vitamins, such as B vitamins, particularly B12, are crucial for nerve function and repair. They help produce myelin, the protective sheath surrounding nerves necessary for proper nerve signaling. Additionally, vitamin D supports overall nerve health by reducing inflammation and promoting calcium absorption, which is critical for nerve function. When the body lacks these essential vitamins, it can lead to deficiencies that exacerbate nerve pain, including conditions like sciatica. For instance, a deficiency in vitamin B12 can result in nerve damage, leading to increased pain, tingling, and numbness. Similarly, low vitamin D levels have been linked to heightened sensitivity to pain, making existing nerve issues feel worse. Introducing vitamins as a complementary treatment for sciatica can be a game changer.